Hi, I'm Dr. Rajani. Filling the chin and creating jaw lines with filler is fantastic. It looks amazing, but I don't want that to happen to you, whether you're a client going to get chin filler or you're someone injecting filler. We have to pay attention to anatomy. How does that happen? We're going to talk about a study that was recently done regarding chin fillers. So there was a recent study done in the Journal of Plastic Reconstructive Surgery on the ascending mental arteries. And a lot of people are filling chins now. It looks amazing. Creating chin projections is important. Why are we doing more of it? Partly is lip fillers have become so common. And lip filler, I did a video on the Hyapen that you can inject in the body to get volume. But injectors, people injecting product, aren't injecting lips. We're injecting lips to create beauty in the perioral region of the lower face. And even we can say the upper face is important for the lips. It's all about dimensions and contouring. And when someone goes to inject lips, what do they look at? That AE line or the rickets line or the line from the chin to the nose. And we want to make sure there isn't a deficient chin, a protruding chin, or if it's not perfect, we can make it more towards perfect. And by adding volume to the chin, it's very common, people who want bigger lips are not liking their chin projection. It's also common because injecting jaw lines has given us attention to the chin. Because if you just inject the jawline and you come in front of where the low-hanging area is here, or the pre-jowl, some people call it, and you want to inject in front, and then you stop here and you go, what about the chin? It's why I almost only do full faces. How can you talk about lips without talking about temples, high cheeks, chin projections, and neck? So it's all part and parcel, but chin fillers have gotten so common, I wanted to bring attention to the anatomy here, and I'll show you how I inject it. There's many ways, there's no one wrong or right, but I'm doing this so people think about cautious and careful. And I'm going to talk a little bit about volume, how much you should put in. If you like these videos, click like below, subscribe here on my left, and click the bell because that will allow you to be notified when all the new videos come up. We do about 1 or 2 a week. To keep your skin and body beautiful and healthy is to stay educated about it. So let's talk about the arterial supply. This was a study done showing where the ascending mental artery was lying, okay? And if you look, let's go to a picture and have a look at the anatomy because it's not just about the ascending artery. So if we watch the injection here, I grab the area. I almost always am injecting below mentalis muscle. Again, there's no one way to do this. I've done hundreds of these, so I just do it the way that I found to be safe and effective for me in creating what I want. Always pull back on the plunger, aspirate. There's no rush here, so you can pull back on that plunger for a good 10 seconds. And then injecting, in general, I'm going to inject in the midline with a single bolus, or in this case, I do two. I do one to the right, one to the patient's left, just left or right of the midline in 2 areas. And this works for me, and I look and check the contour. And then I can go and inject the other side again. Using vibration helps. It's not a particularly painful procedure, but it's almost a must fill as we age and the pre-jowl occurs. And here again, I'm going in for that second injection. Again, this is hyaluronic acid. Tends to last a nice amount of time here. A lot of people might not need some for another couple of years. And if they want permanent, it's not a problem. You can use Bellafill here, which is permanent, PMMA. I often do that if they like the look of temporary fillers and they come back in a couple of years, we can make it more permanent. Again, we don't have to add it all at once, but we can do it slowly to get the projection that they want. And PMMA is a great product for me here. Let's talk real quick about putting filler there. If we put filler there, think about to get chin projection, think about an implant. A facial implant is it's many cc's. People go into an injector, they might get 1 or 2 cc's, 1 or 2 syringes, about $1,500 worth for chin projection. How does that work? A couple things about volume. Certainly you can use several cc's of filler for some people. A chin implant or surgery may be more appropriate, but if they don't want to, they just need a little chin projection or a narrowing of the face by creating more of a point here. Then a couple syringes might be fine, but here's what I would say is be mindful, because if you put too much in at one sitting, it often gets quite sore. And while a lot of people don't believe you can get a compressive arterial occlusion, I believe you can in many places where the tissue is tight. And a lot of times that's at the chin and at the nasal ala. So if I'm doing it, I do a couple syringes, I bring them back for 2 to 3 more. I don't do it in one sitting. I'm a little more cautious maybe, and a little more judicious, and I will get to the end point, but think of it like an implant and you can build up on that. There's no need to do it all at once, and I think it's more dangerous. So if we look at a picture, you can see the submental artery, but also look over here where the mental artery is, and the mental artery is coming out of the foramen, and it a lot of times anastomoses with the inferior labial or the artery of the lip. So you can see it's all connected, and part of the reason that is so if something happens to one vessel, there is blood flow supplied at least in part by another vessel. So the study showed that the ascending mental artery came out just about 6 millimeters to the right and to the left of the midline of the chin in the soft tissue, about 4 millimeters deep. And so it wasn't at the bone level, but all those anastomosis, one thing to consider that we talk about that a lot of people don't think of when injecting this area is that it communicates to the sublingual artery. So in the palate, the bottom palate. And this is all from the external carotid, but the key is if there's pain in the floor of the mouth, that's indicating a problem, and there are cases of this, and that's what I wanted to bring to the attention, because a lot of people wouldn't realize, oh, there's pain inside the mouth. That has nothing to do with the chin, but they anastomose to that sublingual arterial system, which that's the problem. We talk about that in the conferences, and when we do, a lot of people don't realize that anastomosis, which is key to know. So there's a quick video on chin projection. It's become very common. A lot of people, as awareness is being raised, want to have the procedure done. Subscribe here and join me to keep your skin and body beautiful, healthy, and vibrant.